Hello everyone. Now I am going to discuss about the topic of hypertension. This topic comes under medical surgical nursing in cardiovascular system. In this topic we will see totally 8 topics: definition, types, etiology, risk factors, clinical manifestation, pathophysiology, diagnostic evaluation and management. In management totally 3 types we will see: lifestyle modification, pharmacological therapy and nursing management. Now I am going to discuss about definition of hypertension. Hypertension is defined as high blood pressure. In this what we are seeing in hypertension cases, persistent elevation of systolic pressure above 140 mm by Hg and the diastolic pressure is above 90 mm by Hg. In second one, types of hypertension we will see here. Normal blood pressure level is 120 by 80. 120 is systolic value, 80 is the diastolic value. Systolic is a upper number, diastolic is a lower number. Second one is elevated blood pressure. Elevated blood pressure value is 120 to 129 is a systolic value in elevated blood pressure level. Diastolic level is less than 80. Then high blood pressure, it's a stage 1 hypertension. 130 to 139 is a systolic value and diastolic value is 80 to 89 mm by Hg is the diastolic value. Then stage 2 high blood pressure hypertension, stage 2 140 or higher is a systolic value. Then diastolic value is 90 or higher in second stage. Then hypertensive crisis. In hypertensive cases, higher than 180 is a systolic value and the 120 is more than 120 is diastolic value. Third one, we will see etiology of hypertension. In this, we will see primary and secondary hypertension. In primary hypertension, the elevation in blood pressure without an identified causes. That means unknown causes. Secondary hypertension, the elevation of blood pressure and exact cause. That means the 5 to 10 percentage of total cases having the exact causes of hypertension. In this we will see one by one. Congenital narrowing of aorta. In congenital narrowing is by birth itself the aorta having narrowing level. Next one, renal disease. Renal disease meaning is a kidney disease. Next, endocrine disorder. In endocrine disorder like Cushing syndrome we will see for these patients. Next, neurological disorder like brain tumor and head injury. Next, sleep apnea. Next one, medication like oral contraceptive pills, non-steroid anti-inflammatory drugs and cocaine. Then, cirrhosis of liver. Fourth one is risk factors of hypertension. In this first we will see age. Change of coronary artery disease after 50 years of age. Then alcohol, smoking and diabetic mellitus. Third one is excessive dietary intake of sodium, gender, family history, obesity, sedentary lifestyle and stress. Fifth one is clinical manifestation of hypertension. Persistent headache, fatigue, dizziness, palpitation, double vision, palpal edema, that meaning is swelling of the optic disc, both eye it will affect with swelling. Then ear noise. Sixth one is pathophysiology of hypertension. Due to etiological factors, it leads to increased peripheral resistance. It leads to increased venous compliance. It leads to increased venous return. It leads to increased cardiac preload. It leads to diastolic dysfunction. Same like the blood vessels having pressure in systolic dysfunctions. Seventh one is diagnostic evaluation of hypertension. First one, history collection of the patient. Collect the total history of the patient. Then physical examination of the patient. Third one is medical history of diabetes mellitus. Then complete blood count, chest X-ray and ECG. Eighth one is management of hypertension. How to manage the hypertension we will see in two ways: lifestyle modification and pharmacological therapy. In lifestyle modification, weight reduction, dietary approaches to stop hypertension, dietary sodium reduction, reduce alcohol, exercise, and stress management. Next, we will see pharmacological therapy. Various group of drugs are used for the treatment of hypertension. Antihypertensive drugs we will see one by one. In diuretics, we are using furosemide. Next one is beta blockers. In beta blockers, we are using atenolol. Then alpha blockers. In alpha blockers, we are using prazosin. Then vasodilators. In vasodilators, we are using nitroglycerin drug. Then ACE inhibitors. In ACE inhibitors, we are using captopril drug. Next, we will see calcium channel blockers. In calcium channel blockers, we are using amlodipine. Next, we will see nursing management of hypertension. Proper history collection should be done, which includes family history also. Then, dietary habits should be assessed. Identify the medical history such as diabetes, coronary artery disease, renal disease, etc. Instruct the patient to avoid smoking and alcoholism. Auscultate heart rate and palpate peripheral pulses. Identify the use of medications such as contraceptives, steroid, non-steroid anti-inflammatory drugs, etc. Then monitor vital signs frequency. Provide diet which is low in sodium and rich with fruits and vegetables. Monitor the blood cholesterol level frequently. Thank you. Next class we will see any another medical conditions.